All right, everybody, welcome back to the Beat Podcast, hosted live here at Health in Las Vegas. I am here with Ryan Weber, who is a solutions consultant at TransUnion. Ryan's just specializing in the true lookup solution, which you're going to learn about today. And everybody's familiar with TransUnion. They're here at Health to share new perspectives on what they're doing. So, Ryan, so great that you were able to join us.
Yes, thanks for having us. Appreciate it.
Of course. So, hey, look, before we get kicked off with this, tell us a little bit about your role there at TransUnion and what you guys are up to.
Yeah, absolutely. So, a solution consultant with TransUnion, part of our specialized risk group, or True Lookup, is we're also branded as. And specifically, what I do is work with customers to help them understand how our data can help solve their business needs with some of our non-credit data. So everybody's familiar with TransUnion, the credit bureau, right?
Yeah.
So we have a whole slew of additional data assets within TransUnion that can help serve, and especially specifically in the healthcare space where we're starting to reemerge into. And so I help customers look at the type of data assets that we have,
Cool.
and the solutions that we can help solve their challenges.
That's super interesting, man. Let's dig in. How's your organization reimagining care delivery to improve both access and outcomes, specifically for historically underserved populations?
Yeah, so TransUnion supports the entire patient journey from pre-visit to post-encounter with data-driven solutions that improve access and outcomes. We help providers identify and engage underserved populations using enriched data, including financial risk attributes and social determinants of health. Our solutions reduce barriers to care by improving scheduling, verification, and outreach, ensuring patients receive timely and appropriate care. By integrating credit risk insights, we help providers and healthcare organizations offer flexible financial pathways, increasing access for patients with financial constraints. Knowing that many of our healthcare customers have commingled data from several sources that may be outdated, we can help cleanse their patient and member contact data and better phone, email, and mailing address.
Thank you. It's interesting to hear how you can follow that continuum. And there's a lot of technologies out there today. How does TransUnion know where to invest? And how do you measure real-world impact?
Yeah, that's a great question. So we prioritize our innovations that enhance the patient experience, reduce administrative burden, and improve financial performance for providers. Investment decisions at TransUnion are guided by the voice of customer. We also look at regulatory trends and real-world provider challenges. We measure impact through key performance indicators like improved patient engagement rates, reduced claim denials, and faster revenue cycle turnaround. Our partnerships with health systems allow us to pilot and refine solutions in live environments, ensuring relevancy and scalability. And TransUnion also has been leveraging AI across its solution sets for over 20 years and successfully applying artificial intelligence to generate integrated data-driven insights for our customers. Our One True Solution Enablement platform supports our customers' AI efforts by streamlining data access and enhancing the speed and quality of analytics and decision-making.
We're all familiar with the TransUnion data for credit, but what are some of those other areas, Ryan? More so curiosity, like different sources of data. What are the categories?
Yep. So we have a lot of different data. So we have our financial data that we've historically have drawn on with the credit data. But then with some of our other data sources, data assets that we bring in through acquisitions, we can get access to phone data. We can get access to through public record data providers and other alternative data providers. We're able to bring in data that's not necessarily credit related, but it's related around the identity and looking at assets and looking at properties and vehicles and looking at some of the some financial stuff, but also non-financial. We can help build relationships because we tie data together.
Sure.
So we're able, it's just through our different data sources. In my group alone, we have 10,000 different data providers that we're sourcing data from. So we build a comprehensive profile of an individual, which can help bring us success in the market when we talk about updated addresses and phones and emails, helping with those consumer experiences, as well as helping within the SDOH space and being able to provide insights into the patients' lives and what's going on around them, whether it's financial or non-financial.
That's pretty cool. I love that. Appreciate the insight there. Looking ahead the next 3 to 5 years, what bold bet is the company taking and what do you believe will truly transform healthcare experiences?
Yeah, so one of the biggest things that we're investing in right now, and the big focus is on our automated pre-fill. So we really want to help streamline the onboarding process and reduce friction at every touch point with the patient journey. Our pre-fill solutions allow healthcare organizations to streamline the account creation process. It reduces the abandonment rates, and we can receive the correct information on a patient and enhance the overall patient experience. We're also investing in inclusive data strategies to ensure historically marginalized populations are represented and supported.
Interesting. And so how's TransUnion leveraging data to streamline patient access and reduce friction in the care journey?
Yeah, so that's continuing on with our pre-fill solutions where we're able to reduce manual data entry, speeding up the registration and minimizing errors while improving the overall patient experience. Accurate contact data and identity verification ensures patients are reached efficiently and securely and help reduce abandonment during the registration process. We help providers optimize scheduling and outreach, reducing no-shows and improving care continuity. By integrating financial insights, we support eligibility checks, payment planning, and making care more accessible. With the phone channel still a vital part of our two-way communication in healthcare, mitigating spam tags on healthcare organizations' outbound phone numbers and adding correct caller ID to landline and mobile calls was a long way in installing confidence and trust.
That's pretty cool. I didn't know you guys did that. I get spammed all the time.
It's one of those things, right? But that's one of the acquisitions with Newstar that has just really enhanced that ability. And Newstar has a significant role in the healthcare space for a long time prior to the TransUnion acquisition, and really helping making sure that the contact is made, that you know as a patient that it's your healthcare provider calling you, you're more likely to pick up that phone because, as you mentioned, we're all getting spammed left and right. It's hard for us to pick up these calls when we don't know who's calling, and getting somebody on the phone, understanding their phone is the good number that we can get in touch with them, finding the right time to call them, and making sure that they do pick up the phone is what we really focus on.
That's key. Yeah, that's definitely key. And so in an era of rising consumer expectations, obviously you guys are a consumer company, now looking at also this area of helping health systems and larger vendors in the space. How's your organization helping healthcare stakeholders personalize outreach and engagement, especially for patients who are hard to reach or historically disengaged?
Yes. So TransUnion enables precision engagement using verified contact data and consumer behavior insights. We help healthcare organizations segment and target patients based on communication preferences, risk profiles, and SDOH. Our solutions support multi-channel outreach so we can ensure that patients receive messages in the format and language they prefer. We empower providers to reconnect with disengaged patients, improving adherence and long-term outcomes.
Fascinating. And so when you think about trust, that topic always comes up with data, and you guys are in the data game. So what role does it play in your healthcare strategy, and how do you ensure privacy, compliance, and ethical use of consumer data in such a sensitive industry?
Yep, that's a great question. And trust is foundational to our healthcare strategy. TransUnion is committed to ethical data use, transparency, and compliance. We adhere to HIPAA, FCRA, and other regulatory frameworks, ensuring data is used responsibly and securely. We position ourselves as a trusted partner, helping healthcare organizations navigate the complexities of data stewardship in a sensitive industry.
Listen, Ryan, certainly a comprehensive solution with trust and privacy at the center of it. If people want to learn more or reach out to anybody on the team, where can they go?
You can always go to transunion.com and find list of all of our solutions. You can also reach out to me directly. Ryan.weber@transunion.com is my email. It's an easy one. Weber with one B, like the grill.
Nice.
Easy to find.
I love my Weber.
Absolutely. So, but yeah, we'd love to engage with those that might be interested in how our data-driven solutions can help solve their business challenges.
Awesome. Hey, Ryan, thank you so much. Really appreciate you joining us. And folks, thanks for tuning into the podcast once again. As always, reach out to Ryan, learn more. It's all available in the show notes, so take a look at those. Thank you all for tuning in. And Ryan, thanks for being with us.
Thank you so much for having me. I appreciate it.